Hello, my name is Paula Anderson. I'm Finance Director and Deputy Chief Exec in the Trust, and it's my great privilege to talk to you today about the financial position of the Trust during 2021-22. If I think back to the beginning of that financial year, we were only 4 months into the vaccination programme, which had started in December 2020. It was really hard in the March and April, at the beginning of the year, to understand quite how it would play out, both for services, our ability to respond to COVID, what COVID would mean during that year. Would we be facing more lockdowns? What would our staff sickness be like? So quite a difficult year to plan through. I'm going to take you through some of the detail now and try and make sure that I'm able to bring it to life with information about how the money we spent changed services and changed people's lives. Thank you. So when we look at the detail of the financial position during 21-22, we were clearly working with changed financial arrangements that had been determined by NHS England. This gave more flexibility for organisations. It tried to secure ensuring that they had strong cash facilities and that there were no significant risks that sat outside of the plans. Also, there was an increased emphasis on partnership working and system working to make sure that as a system we were able to live within the financial envelope. If we look at the next slide, this just talks about the clear headlines from the revenue position during 21-22, where we were able to break even. There was a technical deficit when you take account of non-cash items such as impairments, but from the perspective of our financial controls with NHS England and the local ICS, we were able to break even. Our total income for the year was just under 402 million, and our spend was a similar value, 73% of which related to staff costs and 11% for premises. We're also able to end the year with a relatively strong cash position, which just means that in the future we've got sufficient cash reserves to spend on capital schemes, which are the bigger financial schemes that go across more than 1 year. The following slide just tries to be clear around some of the areas that are sometimes more sensitive. So in previous years, some of you will be aware we've needed to spend a lot of money on mental health beds that are outside of our internal units. This year we spent 7.6 million on those, but that was all done in a very managed way within relationships that we have with 2 local providers to ensure that we had sufficient capacity in place. Over the course of the year we were able to spend capital funds on providing new ward areas within the Trust, and I'll talk a little bit more about that when we get to capital. We also spent money, an increased amount of money on agency staffing. This is, looking back, this would seem like an obvious thing we needed to do. We needed new capacity to support COVID and to support our patients. Obviously, we have a vacancy level. We also had absence levels linked to COVID, but also general sickness levels. And we saw increasing acuity within our units that required additional staffing. I can confirm that we didn't make any compensation payments for loss of office, and we didn't make any payments to directors that were not on the payroll. We also really limited the amount we paid external consultants. These are things in the area that have had visibility and people have raised concerns about, and it's good to be able to report all 3 of those answers very positively. In addition, we accrued, which means we provided for the cost of untaken annual leave, which was estimated at £5 million by the year end. Obviously, staff found it difficult to take time off, partly because of wanting to continue to support services, but also their own personal positions and whether they wanted to be on leave during the year. We did deliver efficiency requirements. Although the national ask was fairly limited on that, we did manage to deliver 6.8 million, some of which was non-recurrent, and we face dealing with that in the new financial year. We continue to have good governance around urgent procurement requirements, and we didn't step down any of our normal financial controls. So those are the numbers that I've just taken you through, which can sound a little dry, can't they? They're important, but they don't bring it to life. I'm going to talk about our capital spend now, and we have a detailed slide on this. We had quite a significant capital programme last year, 20.6 million. a significant chunk of which was spent on premises, as will be no surprise. Just to understand what that funding went towards, we were able to open a new ward at Alton Community Hospital, which has opened during this current year and will be of significant support during the winter for our patients and also for our local hospitals in ensuring that patients can be in an appropriate setting. There's a lot of work done within our mental health wards, some of which was improving ward environments, such as it was the second year of our dormitory reduction and ensuite provision programme. We spent over 5 million, and that included areas within Gosport and Melbury Lodge and also our Parkland site. We were able to create a new ward environment in Antelope House, which in the future will provide female PICU support for mental health patients. We also made changes to Lee House and Bluebird, both services who support young people. We also ensured that we did important maintenance and addressed any urgent issues for fire safety or ligature reduction improvements. Another significant programmes were the improvements to our technology. This obviously includes replacing hardware and the technical systems that sit behind our everyday activities. But also we were trying to make sure that we did the work that clinicians needed us to do to ensure that they were able to work well digitally and where that supports frontline care, but also helps us support patients in a more digital, virtual way, which means we can support more people, perhaps without them needing to come into a hospital bed or having other changes to their lives. We also supported staff on hybrid working, and that will continue to be a priority as we move forward. Medical equipment was another important area. We opened our new MRI scanner during the year, and we also were able to purchase 4 new X-ray machines for the South West system, as well as other medical items that were numerous. Our capital availability, so the way that we pay for capital is linked to local ICS controls on how much can be spent by each organisation. But we also bid for further funding, and last year we were very successful in bidding for new money that enabled us to prioritise some of the things that I've just talked about. You'll see from the next slide that our cash balances are really healthy. So our closing cash balance was 58.6 million, which is generally the equivalent of about 58 days of operating cash. The cash balance is really important because it helps us support capital expenditure in future years and ensures that we don't have cash flow issues which would prevent us paying local suppliers. So as you can see, with 58 days of operating cash, we have a fair amount of flexibility there. The final slide that relates to 21-22 relates to our charity, Bright Away. We were able to gain significant grants from NHS Charities Together and our local leagues of friends at various locations, and for that we are exceedingly grateful. Fundraising activities were also great from our staff, such as Christmas raffle and other more personal challenges such as skydiving and marathons and all those things that sound quite frankly exhausting. We made some great grants to people, and some of that is highlighted in this slide, but things like the Christmas box for patients and clients was really important. We were also able to arrange staff wellbeing boxes and events or specialised training, which were some of the things we did to try and say thank you to staff and teams for the work that they're doing. Improving gardens and outside spaces is really important, particularly for patients in our ward areas where they can be in hospital for an extended stay. Then it's really important they have somewhere nice to go and to be outside and makes quite a difference to the therapeutic benefit of their stay in hospital. The final slide looks at the financial outlook for 22-23. We've submitted an operating plan which demonstrates a break-even plan. We did this consistent with the national requirements, which included guidance around investment in mental health, the priorities of the national team, which are numerous but include ensuring that we deliver collectively on the elective recovery. So that's people that need to have operations, that are part of planned care and whose waits have been extended because of COVID. We play a role in that within some of our services, and took that into account when we planned for the year. In addition, we knew that there was uncertainty around the COVID impact for 22-23 and how that would impact on both the summer and winter. And as we'll all be aware, there were numerous issues with it over the summer, and we're now about to go into a winter. Vaccinations will remain important, and we will continue to play the role that we need to in delivering that, both with staff and our patients. Inflationary pressures were a massive concern at the beginning of the year and continue to be a concern. We're clearly right now waiting on the outcome of the utilities risk, so the risk to the cost of utilities, and that will have a significant impact. The pay award had just been confirmed, and we know that that is likely to leave a pressure within our local services in terms of the financial affordability. We've got another significant capital investment plan. At the moment that sits at 12.8 million, but will increase over the year as we bid for national funding. We'll continue to do the work around our inpatient units, important work around maintenance, and also our clinical IT systems. So it is another challenging year ahead of us. I know I say that every year, but we continue to have ambitious plans for our services and for our patients, and quality improvement, making the best use of our resources. So, without doubt, some really tough challenges for us. I know that our teams always come together and perform the best they can despite the stressful circumstances. And for that, I'm really, really grateful. Finally, I suppose this is my opportunity to say thank you. Thanks to everyone at Southern who helps us look after the money, as well as supporting services and our patients and looking after people as well as we can. Thanks for listening.